So what we're going to do is, this is a team here that's been taking care of your son, and we're kind of I'm going to update the team a little bit, let them know sort of what's been going on, update them, catch them up a little bit, and then also at the end we'll kind of update you on what's going on, where we are currently, and then where we're going to go from here. So are there any immediate concerns that you have, or anything that what's concerning you most right now?
Just this rash.
The rash, of course, yes. Okay. So do you mind if I go ahead and update
sure.
our team? Okay, so our patient is a wonderful 12-year-old boy who presented to the emergency department with a red, blotchy, and mildly itchy rash for about 3 hours, the last 3 hours. He first noticed a rash on his right forearm while he was playing football in his yard, and then 20 minutes later he noticed the same rash on his trunk and his lower extremities, but he's not sure which one came first. And Mom, please feel free to correct me if anything's incorrect here, okay? So a history of any insect bites or stings is unknown, but Mom reports introducing almond butter to the child's diet for the first time this morning. As well as a recent history of camping 2 days ago, where the child returned home with several bug bites. There's also an older brother with a stomach virus for the past 3 days, and then also the child recently took a trip to Nicaragua 2 months ago. So the patient has a past medical history of asthma with 2 hospitalizations. The last was 2 years ago, as well as eczema. Social history is positive for an appendectomy at age 10. And his current medications right now are loratadine, 5 milligrams daily, and albuterol as needed for his asthma. And also he's allergic to strawberries and seasonal pollen. So his immunizations are up to date. The family history includes Mom, who has rheumatoid arthritis, Dad and a brother with asthma and seasonal allergies, and then the brother also has a severe peanut allergy. The patient lives with his parents, his brother, and a grandfather who recently moved here from El Salvador 1 month ago. So review systems is positive for feeling warm to touch, a possible fever, and the mom noticed that he was feeling really tired last night, generalized achiness, and 1 episode of vomiting in the ED this morning. But she denies any respiratory distress, abdominal pain, or diarrhea in the child. So vitals today were pretty stable. Temperature 37.1, blood pressure 90/44, heart rate 120, respiratory rate 20. On physical exam, generally, the child was sitting up quietly, occasionally scratching his arms and legs, but in no acute distress. On HEENT, was positive for some bilateral clear nasal discharge, and the posterior oropharynx had some cobblestoning appearance, but no tonsillar enlargement or swelling, no lip swelling, and his voice was normal. On cardiovascular, the normal S1, S2, no rubs, murmurs or gallops, regular rate and rhythm. On respiratory, he had some bilateral scattered wheezes, most prominent on inspiration. On GI, the abdomen was soft, non-tender, non-distended, normal active bowel sounds, and no hepatomegaly was noted. The skin, he does have multiple smooth raised erythematous papules, which you can see here. They're sort of varied in size. Some are about 2 by 2, some are 6 by 6 centimeters, with some areas of confluence over his arms and hands and chest, as well as the back bilaterally, but no bleeding, no bruising, scaling, or desquamation is noted. Musculoskeletal, he has a normal range of motion, and on neurological, he was alert and oriented to time, person, and place. Normal muscle tone, 5 out of 5 muscle strength in the upper and lower extremities, both sides bilaterally, and his deep tendon reflexes were 2+ bilaterally, which is perfect. So on analysis, on assessment, we have a 12-year-old boy who's presenting with a 3-hour history of an erythematous rash on his trunk and upper and lower extremities bilaterally. So based on kind of some of the symptoms that you've been talking about that your child has, there's a couple different things that could be going on. I know you said that he had a recent camping trip, and so it's possible that he could have something called Rocky Mountain Spotted Fever, which is essentially when the child goes camping, sometimes they can maybe get bit by something that can cause sort of an inflammatory reaction in the body. It could also be an atopic dermatitis, which is another skin condition that can cause some of that rashing that you see there, and that's pretty common in children that have asthma or eczema, which we know your son has. And it could also just be a generalized allergic reaction to some type of allergen that he was exposed to either during the camping trip or maybe when he was away on his trip overseas. So we're definitely going to do the best we can to get to the bottom of this, and please let us know if you have any questions or any concerns.
Thank you very much.